Hello, doctor. Thank you for taking the time to talk with me today. And before we start talking about COVID-19 in detail, I would like to ask you about the ways to prevent the virus from entering to my country, because at the moment in Tajikistan, there is no confirmed case of COVID-19. Although in neighboring countries, there are already a lot of cases like in Uzbekistan, Kyrgyzstan, China, Afghanistan, and now the borders are closed and planes do not fly. My question is, in your opinion, how should the government and the Ministry of Health of my country prepare for a possible outbreak of the virus epidemic in Tajikistan?
I think basically what you need to do is delay this as much as possible. I mean, this is a transmissible virus, so I think we are going to get problems all around the world eventually. We just have to get it back as much as we can, because if we can delay it as much as we can, we're hoping for a vaccine next year, in the next year to 18 months. Now, the question I would ask is there any cases there that are undiagnosed? Do you have an extensive testing program? Do you know about that?
Well, I know that the Russian government has given us more than 2,000 tests, and I think that they use them. Since now I'm not in Tajikistan, but I'm in Serbia, I'm not sure that I have the correct information.
See, the thing that would really concern me at the moment, and I don't know if this is the case, and I don't want to be causing alarm, but what happened in Italy was the virus was circulating in the community before people realized it was there, before it was tested. And that allowed community transmission to build up to a large amount of infected people. So countries that think they have no cases, and I think unfortunately this may be the case in a lot of African countries, is very concerning for me now, because I'm really worried that the virus might be spreading already and people might not realize it's there. Mm-hmm. But if it's genuinely the case that it's not there, then my feeling is we need to start the preventative measures now. We've always said that a large part of the problem in this epidemic is that the World Health Organization and indeed governments have been reactive rather than proactive. They've waited till they had cases, then they've reacted. What we need to do is anticipate. We know this is a pandemic. We know this virus is going to come in some way, and we have to get ready for it. And in my view, that means we need the social distancing measures and all the preventative measures that we would take if we knew the virus was there. Because that will educate people and get people ready for if the virus comes. But it will also allow us to prevent the spread of the virus just in case the virus is there already and is spreading without us realizing it. Because as you know, Umar, a big part of the problem here is that this enemy is invisible. Mm-hmm. We can't fight it because we can't see it. We don't know where it is. And there's only one way we can make it visible, and that is with testing. We need both tests. We need the antigen test for the presence of the virus, and we need the antibody test for the presence of the body's immune reaction. We are desperate for both. And until we've got that, I think it's safe to assume, the safest thing is to assume that there is some virus there and to have these social closing down measures that prevent it. So that means basically only associating with people from inside your household. Mm-hmm. It means if someone does get sick, they have to be isolated for at least a week, preferably more. Mm-hmm. It means their contacts need to be quarantined for 2 weeks, because the incubation period for this illness is 2 days to 14 days. I think it means doing all of those things now and restricting as much travel as we possibly can. Mm-hmm. This was the problem right back in the early days. The World Health Organization decided not to suspend all flights from China. Mm-hmm. And the virus had time to spread. This has been caused by the state of international travel we had. Now, you probably know from your history, in the past we've had pandemics before. The Black Death arrived in my country in 1348, but it took years to spread around the world. Now it spreads around the world in hours, in days, on aeroplane flights, and that is all through travel. So we need to really curtail the amount of travel that we're doing for the time being until we get this vaccine.
Yeah. So I think that China, in a fight against the virus, gave a masterclass to the whole world on how the government should fight the virus. And I know that, of course, China is a totalitarian country, and it is easier to deal with such viruses. Why are countries like the United States, Iran, Italy, the UK still not doing what China did? I mean, tight control. Is it so hard to convince people not to leave home in these countries? Let's talk about the UK as you live and work there, as I
Yeah,
know.
yeah. The answer is it has been very difficult to persuade people because people have no idea what pandemic means. Now, if you wrote down the word pandemic and said, what does it mean? They could probably give you a textbook definition.
Yeah.
But basically, people had no concept of what this means because it's outside of living experience. The last true global pandemic, I suppose you could count HIV, but before that, the last community spread pandemic was 100 years ago. It was 1918, 1919.
Yeah. Yeah.
The influenza. So no one remembers. So no one understood. So it was clear that the politicians around the world did not understand the potential of what could happen here. That's why they weren't proactive. That's why they were reacting to things that happened. And the Chinese were the same. Initially, they tried to cover this up, and then they did a superb job in containment and testing. So we really need both of those things. We need the containment to suppress this from the top, and we need to test and isolate every case, and we need to quarantine their contacts. These are the weapons that we have against this. So we have to do the blanket suppressing till we get the testing, and then we can do the targeted isolation once we've got more testing. And cheaper tests are coming. My country is currently developing a test that will cost $7 US.
7.
Yeah, for the test, and that can't come soon enough.
Expensive. It's not.
Sorry?
I don't think that it's expensive. It's really cheap.
It's the cheapest so far. Now,
Yeah.
the question about the social compliance. Now, when I realized that millions and tens of millions of people were closed down in China, I thought that probably can't work here because the Chinese population is very disciplined and it's a very totalitarian, as you say, society. But what's happened now is people have come to understand why this is important. People actually know now, they get it, because they've had friends who were sick. They've known people who've died even, and people understand now. And throughout Europe, the compliance with this is very good. I had an email this morning from Spain. They've been closed down for probably nearly 3 weeks now. And this email said that the people understand, and because they understand, they are complying. They are obeying. The population is all very disciplined now. So, you know, Spain can appear quite chaotic to an outsider, but the people there now are disciplined. They are doing what needs to be done because they understand. So it's so important that we educate the public, so we bring the population with us. When people understand, the vast majority of people will obey. Now, there are military patrols, there are police patrols in quite a few countries now that are enforcing this. Yeah. But and there are severe fines and punishments, which is good. But most people understand and are obeying voluntary because they have been educated to understand why this is important. So I'm optimistic that once people understand, they will obey as much as they can. But the big problem is, in so many parts of the world, that what people eat that night depends on the money they earn that day. So for people to close down completely, if they're not being supplied with their basic needs, it's very difficult for them to do this. And this is why I've always been concerned throughout this pandemic. Since January, I've been worried about this, that in poorer countries, this virus is going to spread quite significantly and have a very big effect because it can spread quickly through poor living conditions. People are forced to go out to work for economic reasons, otherwise the children won't eat that day. So they will go out because they don't want to see their children hungry, which you can understand. And as well as that, a lot of these countries have very poor health infrastructure because the amount of people that die, the case fatality rate, depends very largely on how effective the supportive treatment is. So if the supportive treatment is not good, then the case fatality rate is going to increase.
Now let's talk about vaccine because it's really important. Right now, a lot of biotechnology companies are working on it. And do you really believe that we will receive them in this year, or in the next year?
There's quite a few different vaccines being worked on by different teams around the world. And if we get a vaccine next year, if we get a vaccine in 2021, that will be by far the fastest vaccine that humanity has ever produced. Previous vaccines have taken 4 or 5 years.
Yeah.
Now, I listened to Dr. Tedros from the World Health Organization, and 2 days ago he said this: the vaccine will take 12 months from now or 18 months from now. So that means that in the view of the experts at the World Health Organization, you and me are not going to be injecting vaccines into people's arms until the earliest probably is going to be summer 2021. Mm-hmm. Until then, the world needs to live differently. We need to work out different ways to live until then. We need to combine that different lifestyle with that social distancing. But the weapon we do have now, the technology we do have now, is the testing. We can do that now. We just need billions of tests, literally billions of tests. So what I'm hoping is that manufacturers are going to work out a very cheap way to make this test, that they're going to make this information freely available on the internet, that test manufacturers in every country will have the information to manufacture high quality tests locally. Then we don't have to rely on global distribution. We don't have to worry about poor people not getting tests. This information, I really appeal for this, has to be made public so that every biotechnology firm in the world can make huge amounts of the tests. And then once we have the tests, we can have a much more normal economy, because we can target isolation to particular people we know have the virus. We can target the quarantine for the 14 days for the people that have been exposed to that. After the 14 days, they can start getting back out in the world now, because they've passed their incubation period. The other thing is, we know if people are tested for the antibody and they have the antibody, then the consensus of opinion in the world at the moment is that once someone has had the disease, they're going to be immune to it for at least a period of time. Now, there is debate about this, but the virologists that I've listened talking about this, who do seem to know about this best, that there's definitely an antibody that's produced because we've got an antibody test. Yeah. We know that antibodies are immunologically active molecules and proteins. So it seems very, very likely to me, and I think a lot of people are working on this assumption now, that if someone has been exposed to the virus, then they will be immune to that for a period of time. Now, whether that's 6 months or 6 years or lifetime, we don't know. Of course, we don't know yet. My guess would be, and it is a guess, but it would be years. So for most viruses, you'll be familiar with this yourself. For most viruses, once someone has been exposed to the antigen, then very often they're immune to that virus for years, decades, or even for life. Now, we don't know whether that's the case yet. We're hoping it is the case. But if it is, it means that those people can go back to normal life.
Yeah.
Because those people won't catch the virus and they won't spread the virus. Now, there's another important implication here, Umar. That means that these people are going to have to be identified in some way. Now, what the Chinese did was they had traffic lights on people's mobile phones. So you got a red, meaning you couldn't go anywhere. You got an amber, meaning, well, maybe. And you got a green, saying you were clear. Now, people in the Western countries are very frightened of this sort of surveillance.
Yeah, you're right.
But I do believe it is necessary. So I think until we get the vaccine, we're going to need some sort of health passport, if you like, some sort of health clearance. And part of the reason that China, South Korea, and Taiwan have been as successful as they have is that they've had this form of electronic surveillance of the population, knowing who's at risk and who's less at risk. So I think every government's going to need to work out what to do about that, understanding that this is only temporary until we get the vaccine.
Yeah.
Now, the other positive thing here is that most of the virologists are saying that this virus is a very slow mutator. Now, as you know, all viruses mutate, they change their genetics. And RNA viruses particularly change their genetics because they're just one strand of the nuclear material. So there is the potential for this virus to mutate, and there are small mutations in it. But it seems that the vaccine developers believe that these mutations are not sufficient to mean that one vaccine will not do for the whole world. That the strain of the virus will be able to be vaccinated against with one vaccine. And of course, the vaccine developers know about this, and they're targeting parts of the virus that don't change very much for their target. So there is quite a lot of hope here. So I am hoping that the economy can start to get going again until we get the vaccine, but it is going to need a lot of information, and that information has to be based on testing.
So what do you think, is there any chance that COVID-19 will disappear soon, like SARS and MERS?
I'm afraid I don't think there is. I'd love to think there is. Now, with MERS, the Middle East Respiratory Syndrome, that is actually not a very infectious virus. Many of the cases with MERS were actually caused in healthcare workers from aerosolizations before they realized how infectious it was. Now, there are new cases of MERS every year. There was cases documented of MERS in 2019, but they were mostly direct zoonotic spread from camels, mostly in Saudi Arabia and Arabian countries. And then they isolated the people with it and were able to stop community spread because the transmissibility is low. And I'm very pleased about that because, as you know, the case fatality rate in MERS is very high.
Yeah.
It can be about 30%. Now, SARS, the severe acute respiratory syndrome, there was an outbreak of that in 2002, 2003. Now, that was contained, but the big difference here is that with SARS, people shed most of the virus, therefore were most infectious in the second week after contracting clinical features. Whereas with the current one we have, the current it's called the SARS-CoV-2. It's a similar type of coronavirus, but it's the one we have now. The thing is with this is the COVID-19 is transmissible. People shed the virus before they get symptoms, and for the first few days when they have minimal symptoms. And as well as that, some people seem to get disease which is essentially asymptomatic. So they can carry on working. They might not feel great, but they don't feel very ill. But those people can be shedding the viruses in huge amounts. And this is why we've had super spreaders, people that have spread the virus to 10 people or 20 people because they didn't realize that they had it and they didn't realize they were shedding the virus. Whereas with SARS, people that were shedding the virus would be lying down ill and groaning because they felt so bad. They wouldn't be up and about. So that to me is the main difference. So given that we have this pre-symptomatic and asymptomatic spread, I think this virus is going to carry on spreading. I think the main role for you and me and for everyone who's listening to this is to slow it down and wait for the tests and wait for the vaccines. And until then, just acknowledge that life has to be a little bit different.
Yeah. So what do you think, how the world will look after the coronavirus pandemic?
That's a very good question. Things will recover. We've had pandemics before. What we have to do is just make sure that we mitigate the damage as much as we can, that as few people suffer and die from this as is possible. After the pandemic, of course, there will have been a lot of deaths. There will be a lot of mourning. There will be a lot of grieving. But things will get back. There's no reason why individuals, families, economies should not make a full recovery. Now, this will be expensive. This is like a war. So we're going to be paying this back for some time. Economies are going to be paying this back for some time. But that's okay. We can do that. We just have to live a little more frugally. So if this teaches humanity to live in a more simple way, if this teaches humanity how important it is to let the truth come out and not suppress it like they did in China, If this teaches us to work together collaboratively, then the potential is that this could, in the long run, be good for us.
Got it. So right now, many migrants from Central Asia live and work in Russian Federation. As you know, there are a lot of cases there already, and many of them will watch us there. And I would say that these are mainly young people. Should they panic about this virus? Because as a doctor, they write a lot to me, and I see how many of them are panicking. For many, this is not fear, but panic, really panic. What is your message to them?
The message is that yes, there is a degree of risk for everyone. Now, young people can contract this virus. Indeed, we believe children can contract this virus just as the same as older people can. But the difference is, if you contract it and I contract it, I'm more likely to die than you are because I'm older than you. So the risk of death increases with increasing age. And the risk of death also increases with comorbidities. So if someone has hypertension, diabetes, heart disease, chronic lung disease, immunodeficiency disease, all these things are going to increase the probability of severe complicated disease. But having said that, there are tragic cases of young people who do get severe disease, who are otherwise healthy and don't have comorbidities. So it does happen. It's just much less common. And again, thankfully, children don't seem to get very ill with this. Again, there are the rare exceptions, but most of them don't seem to get very ill with this. But of course, what the children do is they spread it to their fathers, their mothers, their grandparents. And this is what happened a lot in Italy. In Italy, very often there's 3 generations live in one household. So the children can come home, transmit the disease to the grandparents. The children will be better in 2 days' time, but the grandparents can develop severe disease. And that's one of the reasons we've seen such a high case fatality rate in Italy. So I would say to those people, try and keep calm, try and keep rational, practice social distancing, practice meticulous hand hygiene, stop shaking hands, stop hugging, stop kissing people that are outside of your household, keep 2 meters apart as a minimum, avoid crowded, stuffy, poorly ventilated areas. That's one of the ways that this has passed on in China. It's spread in buses because they were poorly ventilated. In winter, all the windows were shut because it was cold, but that meant you had a very poorly ventilated space inside. And for a period of time, the virus was in the air. There was some air spread of this virus for a period of, there's argument about how long that is, but it did happen in China for a period of time. So practice all of these things. Wash your hands, especially wash your hands before eating. If anyone does get sick, then they need to be isolated as much as is possible. And their contacts, their household, need to be quarantined, ideally for 14 days or more. So it's practicing these simple things that we know about. These are called non-pharmaceutical interventions. If people are getting sick, there's a debate at the moment whether we should take ibuprofen. All I can tell you is if I got sick, I would not take ibuprofen.
So you will take
I would not take it. No.
What about
ibuprofen? Having said that, I don't understand the full pharmacology of what's going on, but at the moment I would not take it.
So what do you think about paracetamol?
Well, that's a very good question, Umar, and it's a very complicated question. Now, when someone is sick, they get a fever, and that is quite deliberate. You know this. The body releases cytokines.
Yeah.
That affects the prostaglandins in the hypothalamus. The fever is not an accident. It is not a side effect of the virus. It is a deliberate mechanism of the body. And when you increase the body temperature, that is going to reduce the ability of the virus to multiply. And there's also evidence that increasing body temperature increases the efficiency of the immune system. So, for example, the studies that shown that white cells can migrate more quickly at pyrexial temperatures, at high fevers. So for adults, and this is my personal view, for adults, if someone has a fever, then I think it's best to let that fever run.
What about children?
Children are a very complicated issue, and it would take quite a long time to explain it. You know as well as I do that children under the age of 2 can't control their body temperature, so we tend to bring their temperatures down much quicker.
That's why I'm asking.
Yeah, so young children, we tend to bring the temperatures down at a much earlier stage. But but for adults, it's people are very often frightened of fever. They say, well, won't the fever kill someone? Well, actually, it's the virus that kills people.
Yeah.
If you have a fever of 39 degrees centigrade, that is not going to kill me. If I have a fever of 40 degrees centigrade, that's not going to kill me. And it seems with this virus that the fever doesn't go up much beyond about 39. All I can say as a general principle, fever is a body's natural defense mechanism.
So they should not take any medication until they feel that they can get up, they can drink water.
I cannot tell people what medication to take and what not to take. I'm not their doctor, so I can't do that.
Yeah, you know, a lot of people ask me, what should I take? Should I take paracetamol?
We can't do that online.
Yeah.
It can't be done. They need to see. People must see local doctors about drugs. We can't do that on the computer. That cannot be done.
So it's great. Thank you, doctor, for taking the time one more time. It's really cool. And I think and I hope that this virus, we will fight this virus soon. I hope so. So have a good day. And thank you one more time.
You too. And I wish you and your country well and everyone in the world well.
Thank you, doctor.
Okay, thanks, Umar. Thanks.
Bye.